Welcome back to Crack the Cure series with me, Kavitendral. If you have not subscribed our channel, please do subscribe for more interesting videos like this. In today's session, we'll be seeing about how to easily remember the clinical signs in thyroid ophthalmopathy, and this is part 1. First, we'll see the basic pathology in thyroid ophthalmopathy, then we'll go on to clinical signs. At last, a quick recap. Thyroid ophthalmopathy is actually the extrathyroid manifestation of the thyroid dysfunction in the eyes. The common etiology of thyroid ophthalmopathy is autoimmune etiology, and thereby the TSH antibodies are getting produced. Whenever this TSH receptor antibody are produced, they act on TSH receptor, especially on orbital fibroblast and pre-adipocytes. This in turn increases the volume of the bony orbit and it pushes the eyeball outward. That is the abnormal protrusion. Let us see the clinical signs now. The toxic signs of eye are exophthalmos, Rimple sign, Van sign, Joffroy sign, Mobius sign, and Stelwak sign. First, what is exophthalmos? We know exo is out, ophthalmos is the eyes. Here, the eyeball is abnormally protruding from the bony orbit. Next is Van sign. To remember Van sign, we'll remember like a traffic police. This traffic police is directing the vehicles to come and go. So basically, when the eyeball is moving, there is something also coming with that eyeball, that is, I'm meaning the upper eyelid. So whenever on downward gaze, the upper eyelid is not following the eyeball, that is, there is a lid lag, then that is Van sign. One, it is like coming like that. So when the eyeball is on downward gaze, the upper eyelid is not coming down, that is Van sign, lid lag. Next is Rimple sign. Rimple sign, let us stick on to re. This re is similar to this re, so it is retraction of eyelid. Because of retraction of eyelid, we can visualize the upper sclera. Dalrymple sign is retraction of upper eyelid and uh, visualization of upper sclera. Next, we move on to Joffroy sign. Here, we'll again stick on to F and R. F and R, it is similar to F and R of frowning. Joffroy sign is seen in pathology, so therefore frowning is also absent. Let us think like that. So loss of frowning is Joffroy sign. With this frowning we usually see in the forehead, and thus the Joffroy sign, there is loss of frowning. Next is Mobius sign. Let us decode the word Mobius. Let us say mob as like mobility. As is a word that denotes like together, we are all one, like that. So as we are speaking about eyes, so two eyes as means it is going to come towards, so they are going to meet. That is the mobility of the eyes meeting together on the nasal side. It is, we know, it is convergence. So it is again a pathology. Mobius sign is loss of convergence or poor convergence of the eyeball. Next is Stelwak sign. Again we'll think like Stelwak, someone is stealing and walking, Stelwak sign. Okay, so steal, it is sounding like stealing and walking, Stelwak sign. When someone is stealing and walking, what will be our look? It is like staring look, we don't blink. And yes, Stelwak sign is infrequent blinking and staring. That's it. Now we'll come to a recap. Dalrymple sign, so it is retraction of upper eyelid and upper sclera is visualized. Van sign, one, again that is what is not coming, there is lag of upper lid. Next is Joffroy sign, FR, that is loss of frowning. Next is Mobius sign, mobility as towards, that is poor convergence. Next is Stelwak sign, someone is stealing and going like that I said, so it is infrequent blinking. Thank you so much for your patient listening.